I'm going to start with Chapter 4, Part 6, and we're going to talk about communicating with the hospitals specifically. And sometimes you're going to have to consult with medical control to get orders to administer medications, or maybe you're just confused and you need help with trying to figure out what's going on with the patient. So you may need to utilize medical control for that, or you may also need to notify them that you are coming in with the patient, giving them an ETA so that they can have a heads up to get ready. Trust me, showing up at a hospital with a cardiac arrest without them knowing anything about it is not a good thing. So you want to make sure that you let them know as soon as you can with anything major, so it gives them some lead time to get things prepared and ready. Plan and organize your radio communication before you transmit. Just don't call up and just spew something out, because then you're scatterbrained and nothing flows good. One thing that I do is I have a standard report that I use for every patient, and I've been doing it for a while, so it's just automatic. So I know how to organize my thoughts and my information for when I give my patient report. So make sure you deliver your report in an objective, accurate, and professional manner. Follow your standard format established by your local EMS system. And just remember, people with scanners may be listening, so do not use the patient's name or their address or anything that could identify who they are or where they came from. So, depending on your protocols or your standing orders, you may need to call medical control to give medications, to determine transport destination of patients, and some facilities or some agencies require you to call medical control to get permission to fly a patient out. And you may need to call medical control to stop treatment or decide not to transport a patient. And sometimes you can utilize medical control to help you with patients who are refusing. Sometimes it's good to let them speak to the doctor, and sometimes once they speak to the doctor, they may allow you to transport them. So just remember, medical control is either offline or online. If they are online, that means you are talking to them directly. If it's offline, it's a standing order. So in most areas, your medical control is provided by the physician working at the receiving hospital. So if you need orders or you need consultation with something, you would contact that physician at the receiving hospital, or in some areas have a centralized hospital that you will always utilize. So never use codes unless directed by protocol. A lot of nurses and physicians and stuff do not understand codes, so it's just best to just use your medical terminology or just plain jargon. Just remember this, and using medical terminology, if you are not 100% sure of what you're saying, use plain English, okay? Once you receive an order, make sure you repeat it back to the physician. Make sure you repeat it back. And then, also, what you want to do is, or just stand by. So once you receive an order, make sure you repeat it back, and do not blindly follow an order that does not make sense. If it does not make sense, repeat it back to them. Ask questions, because we're here to do no further harm, and if it doesn't make sense, then somewhere someone's not understanding what's going on. So make sure you may have to paint a clearer picture or something. So some special circumstances. Here, advise hospital if any of these situations exist, like you have a hazardous material situation, you have a rescue in progress, or multiple casualty incidents. You want to contact them as soon as you can so that they can be making preparations, because if you have a hazmat situation, even though the patient was deconned on the scene, they have to be re-deconned before they can enter the hospital. When notifying hospitals, remember, the earlier the better. Provide an ETA of how long it's going to take you to get there. Provide an estimate of how many people are involved, and identify any special needs. For instance, if you have someone who does not speak English, they may need an interpreter or so on. So effective radio communications. Use your system effectively. Make sure you know how to use your system. Make sure you know the features of your system before you just run out there. So when you utilize your standard radio operating procedures, it reduces misunderstandings, which means utilizing the correct set of codes, which we shouldn't be really using codes anymore anyway. And if you're ever in doubt, use regular English, just normal everyday jargon. Keep your transmissions brief because other people may be trying to get on the radio to give reports or ask for help. And develop effective radio discipline. So that means keep it brief, only say what you need to say, and free up the radio waves so others can use it. And follow your local protocols at all times. So that concludes this part. The next section we're going to get into is we're going to get into maintenance of our radio equipment.